We do the gluteal region on the posterior side of the female. The first thing we want to find are the gluteal muscles. We have three gluteal muscles: Gluteus Maximus, Gluteus Medius, and Gluteus Minimus, and they're in order from superficial to deep. So the largest, most superficial one here is Gluteus Maximus. Cut Gluteus Maximus, flip this out of the way. The next one down here is going to be Gluteus Medius. Cut Gluteus Medius, move this one up and out of the way a little bit, and then we get a little window in here to Gluteus Minimus. All right, let's put these back here. Also in this area, we are going to have the hip stabilizer muscles. So in this area, you want to locate the sciatic nerve first here. And if you trace the sciatic nerve back up proximally until you see it emerging from the pelvis, that is going to show you where the location of the first hip stabilizer muscle is, which is piriformis. So follow the sciatic nerve up, and in this particular case, you can see that the sciatic nerve is emerging in two different spots here. Right here and here. And that is causing a true split in the piriformis muscle. So here, in this area, both of these things, this and that there, are both piriformis, and you can see that proximally piriformis is completely separated to allow this part of the sciatic nerve to come through. Sometimes we don't have a true split in that particular muscle where the proximal ends of piriformis will be joined together, and that can cause pressure on the sciatic nerve, but in this particular case we have a true separation in piriformis. So that would be the first hip stabilizer. That's piriformis there. Then we're going to take the sciatic nerve and we're going to lift it up out of the way here, and in this area we have a bundle of three muscles together. This is going to be your superior gemellus muscle. Then this tendon here is going to be for obturator internus, and then this one is going to be inferior gemellus. Now I separated this just a little so you can see where the tendon and the muscles are. So that's superior gemellus, obturator internus, inferior gemellus here. Now note that in this area we're just seeing the tendon for obturator internus, and if we want to follow this one up, all right, if we move things out of the way here, we can follow up that same tendon here. So that's the obturator internus tendon. You follow it up, you can start to see the contractile part of that muscle there, which is going to continue underneath of this ligament here, which is going to be the sacrotuberous ligament, and then we can continue and see the rest of the muscle belly for that muscle over here on this side here. So that's going to be for obturator internus. Some other things to note right in this area here is if I pull this up a little further, we can follow up that sacrotuberous ligament a little further, and then right down in here, move this out of the way. What you uncover in this area right here is going to be the ischial spine, and that is going to be the beginning of the sacrospinous ligament, which is going to go up in this direction. So sacrotuberous ligament here, sacrospinous ligament there. And what we have hooking around the ischial spine here are these vessels right here, which are going to be the pudendal vessels. So we have a pudendal nerve and then artery and vein that are accompanying that, and they're going to course underneath sacrotuberous and emerge over here on top of that obturator internus muscle. All right, let's move this stuff back up out of the way here. Once we get down below that group of muscles, so again we had piriformis here, superior gemellus, obturator internus, inferior gemellus, and then the last one that we're left with down here that we can see is going to be quadratus femoris. That'll be here. We have one more hip stabilizer, which is going to be obturator externus, and that one on this side, right down in here, in between inferior gemellus and quadratus femoris, down in here, we'd be able to see the tendon for obturator externus. It would be deep in between those two. You could see the contractile part for obturator externus on the anterior side of the body, and you'd have to look in between pectineus and adductor longus on the anterior side, and you'd find the contractile part for obturator externus. All right, other things we can see in this area here. We already identified the sciatic nerve, so we can see that there. We can also see a couple of arteries and veins in this area. If we take Gluteus Medius, move Gluteus Medius up out of the way here, like that, we can see that piriformis here is in between a group of vessels that are emerging here
and another group of vessels, if I can get this over, that are emerging above, or I'm sorry. If we look at piriformis here, we can see a group of vessels emerging above piriformis here, and another group over here emerging below, which are going to come down this way. This group of vessels above piriformis are going to be superior gluteal vessels, and here we have arteries, veins, and nerves coming out here. And this bit below, now you have to discount the sciatic nerve here, but the other stuff beyond the sciatic nerve, this bit over here that's coming out is going to be inferior gluteal vessels coming down in this direction. We can see some branches of that coming up here as well. When we're looking, another thing we can see here is when we're looking at Gluteus Maximus here, we flip back the distal part of Gluteus Maximus. Here you get a really good picture of how only part of Gluteus Maximus, about the inferior third of it, is actually attached to the femur along here. All right. The superior 2/3 of this muscle, this part, we can see comes down, and you can follow this going around this connection to the femur here, and we're going to attach down onto this tissue here, which is going to be called the IT band, the iliotibial band, and that's going to continue all the way down to the tibia. So most of Gluteus Maximus is actually not attached to the femur at all. Only this inferior third, the upper 2/3, is going to go around the femur this way and attach down onto the tibia. Looking at the posterior thigh on the female here, the only muscles we have in this area are the hamstring muscles. Hamstrings are going to be comprised of 4 different muscles. We're going to have 2 on the lateral side and 2 over here on the medial side. We can see that split right here. The 2 that are on the lateral side are going to be biceps femoris long head, which is this muscle that you can get your finger around here. And then if we move this over this way, we can see biceps femoris short head coming up and joining into the long head distally. So here's long head coming down this way, there's short head coming up that way. Those are going to be the 2 on the lateral side. And then the 2 over here on the medial side will be these 2 muscles here, which are going to be semitendinosus, the more superficial one, and then semimembranosus, which will be the deeper one. We can see the tendinosus is a little thinner, membranosus is a little thicker. All right, and those 2 will be on the medial side. You want to note that only 3 of them attach up onto the hips here. We can see this bony process sticking up here is going to be the ischial tuberosity, and that biceps femoris long head, tendinosus, membranosus, they all originate from the ischial tuberosity here, but you can clearly see here that short head of biceps femoris is originating from the posterior side of the femur and does not actually cross the hip joint. All right, all 4 of the muscles are going across the posterior side of the knee and attach down onto the tibia. All right, when we're looking at the posterior leg here, we have 3 different compartments. We have a posterior compartment, a posterior medial compartment, and a posterior lateral compartment. And that has to do with how do these tendons come down and communicate around the ankle joint. The posterior compartment is going to come straight down towards the calcaneus. Posterior medial is going to pass around the calcaneus on the medial side to get down to the plantar side of the foot. And the posterior lateral compartment is going to come around the lateral side, get down to the lateral side of the plantar foot. So looking here at the posterior muscles, the first ones we want to look at are the calf muscles. We have 3 of them. You have gastrocnemius, which will be the most superficial here, and we can see a medial lateral head, gastrocnemius. I cut the medial head so we could flip this out of the way. Deep to gastrocnemius, you're going to have this small muscle here, which will be plantaris, and we can follow this long tendon up and see here at the proximal end where the contractile part is, and then deep to that, the rest of what you're left with here is going to be soleus. If we take those 3 muscles, we can see down on the distal end that they have one common tendon here, which would be tendocalcaneus, going down to the calcaneus. We take the calf muscles and flip them out of the way here. We expose some of the vessels in this area. We're going to move these vessels over this way, and in this area here, we uncover this short muscle here, which will be your Popliteus muscle. That's going to be right on the back side of the knee. It's Popliteus there. And just note that the inferior border of Popliteus will match up along the superior border of Soleus. All right, so those 2 muscles are going to meet right there, and what goes in between those 2 muscles there are these vessels. All right, so these vessels are going to dive deep right in between the superior border of Soleus and the inferior border of Popliteus there. All right, so those are the posterior compartment muscles. Now let's move over and do the posterior medial compartment. And we're just going to rearrange this a little bit here. And what you want to note in this area is we have 3 posterior medial muscles. You're going to have Tibialis Posterior, Flexor Digitorum Longus, and Flexor Hallucis Longus. And if you're identifying these muscles close to the ankle, so we have the medial malleolus to the calcaneus here, that the one closest to the medial malleolus is going to be Tibialis Posterior, which would be that one. Then you're going to have Flexor Digitorum Longus, then you'll have Flexor Hallucis Longus. So that would be the order there. But note, as we move more proximally here, so if we're looking up in this area and we're looking at the bodies of these muscles, that the order is going to be slightly different more proximally. Here, the one that's most medial will be Flexor Digitorum Longus, then Tibialis Posterior, then Flexor Hallucis Longus. And you can see how these 2 muscles here crisscross in this area. You see how Flexor Digitorum Longus is going to come over to this side, where Tibialis Posterior is going to go over to that side. So we see that crisscross right in that area. So just pay attention to where you are. If you're more distal or more proximal, the order changes a little bit. If we follow these muscles down, we can see that Tibialis Posterior, that one is going to come right over here and end over towards the medial side of the foot, not make it down to the toes, where Flexor Digitorum Longus, we can see here, we can see the tendon for this one again here, and we can see this coming out, and this is going to attach to all 4 toes there. Where the other one here, Flexor Hallucis Longus, we can see there, we can see the tendon for that one here, and that one's going to make it out to the big toe there, to the hallux. And then we're going to have the posterior lateral compartment. We got to come over to this side, and for this, open these, let's pull these vessels back out of the way a little bit here. For this, we're going to have 2 muscles that are going to be posterior lateral. This is going to be Fibularis longus and brevis. And you can see that the one that's more superficial here will be Fibularis longus. The one that's deep to it here will be Fibularis brevis. And as you follow these down, longus is going to come down behind the lateral malleolus, wrap around the bottom of the foot, and actually attach over to the medial side of the plantar side of the foot. Where brevis is going to come down in the same path, but brevis is going to end over here on the lateral side. So longus will have a longer tendon, which will wrap around the plantar side of the foot. Doing the vessels on the posterior side of the leg. Starting here, we can see a good picture of the popliteal vessels here emerging from the adductor hiatus. So we can see part of the tendon for adductor magnus coming down this way. You can see a little bit more of the muscle in this area, and we see these vessels emerging right from that opening. So they'd be femoral when they were on the thigh, and we start calling them popliteal when we see them emerge on the posterior part of the leg. So we follow the popliteal vessels coming down through the popliteal fossa, and we're going to trace this all the way down. And the first branch we want to look for is where the popliteal artery is going to split this way into anterior and posterior tibial arteries. And where you're going to find that division is if we put soleus back down. So put soleus back where it was, this way. You want to mark the superior border of soleus and see where do these vessels intersect with that superior border of soleus, which can be right around there, right about here. And that should be approximately where you're going to find that division for posterior, or anterior and posterior tibial vessels. So we can see that here. Move this way. Just get it out of the way like that, like that. Okay, right there. So we can see here where you have popliteal artery coming down, and on this end it's going to be posterior tibial, and that one that's diving straight down this way is going to be anterior tibial. So you see that split there. Anterior tibial we pick up on the anterior side. Here we can follow posterior tibial down a bit further, and we can see it's going to go all the way down here. There's one other branch we want to be able to identify, off of posterior tibial, and that is going to be right here. We can see the posterior tibial continues this way, and then we have a branch that comes off to the lateral side, this one here, and that's going to be your fibular artery. And if we follow posterior tibial down further past that fibular branch, we can see it coming down here. We can see it here, come all the way down, and on the posterior medial side of the ankles here, you can see that we cut a muscle here, which is going to be adductor hallucis. We cut that out of the way so that we can see where these vessels are actually passing to the bottom of the foot. And here we can see a good picture. If we hold this up this way, here is the posterior tibial artery. We can see it splitting here and there. This branch being the lateral plantar artery, that being the medial plantar artery. And if we pull the veins back over, you can see the veins doing a similar thing here, here, and there. And then those medial and lateral plantar branches are going to run along the medial and lateral plantar eminences on the bottom of the foot. Looking at the plantar side of the foot here, the first thing you want to identify is the connective tissue here in the center of the bottom of the foot, and that's going to be the plantar aponeurosis. And that aponeurosis is going to be in between the two eminences. So over here on the medial side, we have the medial plantar eminence, and over here on the lateral side, we have the lateral plantar eminence. So if we look into the eminences, they're going to be comprised of muscles, and we can see again here's the muscle that we cut, all right, which will be abductor hallucis. We can see the tendon for it there, and then just medial to that, open this up a little bit here, we can see that this muscle here, all right, this whole thing in this area is going to be flexor hallucis brevis. So we have abductor hallucis, flexor hallucis brevis. Those are on the medial plantar eminence. And if we come over to the lateral side, we see all the way over on the end, we have this muscle here, which would be abductor digiti minimi there, and then just inside of that, open this up a little bit here, we have this muscle here, which would be flexor digiti minimi. So flexor digiti minimi, abductor digiti minimi, those are the two that are in the lateral plantar eminence. Here, take the plantar aponeurosis, and we're going to turn this over this way, and we can see embedded on the underside of the plantar aponeurosis is going to be flexor digiti embedded on the underside of the plantar aponeurosis is going to be flexor digitorum brevis. We can see where we had to cut it here. You can see the proximal end of it there. So that muscle is going to go from the calcaneus down to each one of the four toes. That's flexor digitorum brevis. When we flip that out of the way, the next muscles that you'll be able to see here, if we hold up here, we're holding the tendon for flexor digitorum longus. And there's one part of the tendon. Here is the more proximal part of the tendon there, so you can see that tendon coursing through here, and we see a muscle over here which attaches to that tendon from the lateral side. That's going to be quadratus plantae. All right, remember that muscle's purpose is to correct the tracking angle of the flexor digitorum longus tendon. From this same spot, if we're on this flexor digitorum longus tendon here and we go more distally, we can see that on the medial side of each one of those tendons we have a little muscle, and that's going to be lumbrical muscle. So we have first, second, third, fourth lumbrical muscles there, and they're going to be alongside of the flexor digitorum longus tendons. If we take this whole thing and we move it over this way, like that, here, and we open up this area, we are looking down here at the adductor hallucis muscles, and you can clearly see the two different heads. We have the oblique head of adductor hallucis here, and we have the transverse head of adductor hallucis here. All right, so transverse head, oblique head. And then also down here, we move this over a little bit more. If we go lateral from the oblique head of adductor hallucis over this way, you can see a few of the plantar interosseous muscles in this area.
doing the nerves on the posterior side of the lower extremity, we're going to start with what we identified already, which will be sciatic nerve here. So we see a sciatic nerve emerging from the pelvis here. We're going to follow that down. We can see the sciatic nerve coursing down the posterior thigh. And in this area here, we can see where the sciatic nerve is going to split. And you see it has a medial and lateral split, with the medial branch going this way being the tibial nerve, and the lateral branch going over here being the common fibular nerve. If we follow common fibular down a little further, just move some of this fascia out of the way here, we can see right here where the common fibular nerve is going to wrap around the lateral side of the knee, and it's going to pass right over the head of the fibula, and then we would pick this up again on the anterior side. Over here, if we go back here where we have the tibial nerve, we're going to follow this down, and we're going to take the calf muscles and reflect them a little bit, and here again is that tibial nerve. We follow that down. In this area, we can see the tibial nerve going down along the posterior aspect of the leg, and we're going to follow the tibial nerve all the way down until it crosses the ankle joint right there, and we can pretty clearly see tibial nerve splitting here and here, and that's going to have the same splits as the artery and vein that are more superficial to it have, which is going to be medial and lateral plantar nerves, and then those nerves are going to course along the medial and lateral plantar eminences, same as what the artery and vein did in that area.